Today we are doing a PRP injection for hair restoration. So I've already drawn our patient's blood, spun it down, and her platelets are very, very concentrated in 3 little syringes. I've already also prepared her skin with some Puricin to clean it. And now what we're going to do is we're going to go ahead and inject her platelets. And over the next few months, her platelets are going to recruit her stem cells over to her scalp, and they're going to help those hair follicles come back to life. So it'll help her hair be longer and thicker, and if those hair follicles are dragging, it's going to help restore them. So we are going to go ahead and get started. And this is our Zimmer. So we use this sort of as ice, as in kind of anesthesia for this treatment. You can use lidocaine as a ring block, but a lot of times this works just as good, if not better, than doing 50 more injections of something in the scalp when we can do just the one injection and be done already with ice. So this blows negative 18 degrees at her, so hopefully it'll be some nice anesthesia for her. Okay, are you ready? Mm-hmm. So here we go. We'll start right here, 1, 2, 3, here we go. And we're just gonna kind of go all over the scalp, using little tiny aliquots of platelet-rich plasma. Some spots may be a little bit more sensitive than others. Now we're going to go back. You okay? Mm-hmm. And so you'll see this doesn't take very long to do. The results take a little while though, because stem cells don't help hair follicles too quickly. They need to take their own sweet time. So I tell people about 4 months. And usually we do anywhere from 1 to 3 treatments in the first year. And then I recommend once a year or every other year, or every 18 months I should say, to repeat this treatment. A lot of times people want to repeat it sooner than that because they like the results. Women especially do really well with this treatment. So what might take a man 3 treatments will take a woman 1 or 2. So that's always good. If you're bald, this does not help. So it's not going to bring back dead hair follicles, but it's going to help restore hair follicles that may be just suffering a little bit. And I always recommend to make sure that all your hormones and everything are in check, and there's nothing that you're doing that's contributing to hair loss. If you just had a baby or something like that, you would wait until after, a year or so if there's an acute stress like that to do something like this. There's multiple steps to doing PRP for the hair too. So we use a shampoo, and then it's sort of like, I will say this a lot about PRP for the hair restoration. I make an analogy to gardening. So we like to use a shampoo for the soil, which would be your scalp. We like to then plant the seeds with the PRP, and then we are going to use our microneedling device to be equivalent to rototilling, and we'll do that next. And then she's going to get a serum for home to use like a fertilizer, and then she'll use the laser cap like a greenhouse, and all together really helps all together. Now you can do one or 2 of the steps, but honestly, if you're wanting to really make the biggest difference with your hair, you're going to want to do all of the steps. So we're going to come back up here and start up here now. Okay. There we go. It's maybe a little tender. So just little tiny bits of platelets. You can find different, results depending on the centrifuge that you use. And if you've gone to certain places like this and you've not found results, it may be because they're not using a good centrifuge. So centrifuge matters. How many platelets you can concentrate matters with your results. Okay, I'm going to come over here now. All right. Good job. You're doing great. So today you'll be a bit sore,
Okay.
and then tomorrow will be better. You may not be sore at all tomorrow.
Okay.
So you're just going to want to keep you don't want to wash your hair for at least 8 hours after this.
Okay.
I don't want you running and jumping in a lake or going anywhere that it's going to be dirty, because you're going to have thousands of little tiny
Holes in my
open channels in your scalp. Yeah. So no mud wrestling or anything like that for the next couple of days.
Okay. Can I get my hair wet tonight?
After 8 hours.
Okay.
Yeah. I always recommend using an icky pillowcase tonight,
Okay.
because its serum is kind of
Leaky.
crunchy and stuff. So yeah, we're just going to do this last little bit over here. You doing okay still?
Mm-hmm.
So we're going to go right here. There we go. You're doing so good. We're almost done.
Okay.
But could you imagine getting more pokes with just lidocaine?
No.
Yeah.
Not at
So,
all.
Yeah. The PRP is pretty amazing in and of itself. They've used it for years in orthopedics and in dentistry, and now in aesthetics. So it's proven to work to restructure in many different ways. All right, cool. And now this is your platelet-poor plasma,
Okay.
and I'm going to just kind of drip it on you. So we're going to put it like a little conditioner in your hair. Let's
Lovely.
call it a conditioner.
Lovely.
It's a crispy conditioner, yeah, but a conditioner nonetheless. And then we're going to microneedle that. So the microneedling itself will help stimulate those hair follicles, but then we're going to microneedle in the platelet-poor plasma. And although it's platelet-poor, there's still good stuff in it. So why not use it all? It's yours.
Mm-hmm.
We got it, so might as well use it. And now we're going to microneedle. Just like this. You okay?
Mm-hmm.
Awesome. Harder to microneedle people when they have longer hair, but just need to penetrate the scalp a little tiny bit. So, are you doing okay?
Mm-hmm.
Feel like a vibration, or
Yeah.
is it hurting you?
It's a little pinchy, but it's not awful.
We don't have to take too long to do this. It doesn't take that long. You're doing awesome. Really, everybody's a candidate for this. Everybody that's got thinning hair. I always like people to, like I said, check hormones and things like that to make sure that there's nothing else happening making you have hair loss. But most of the time it's genetic. I love when people take oral hair, skin, and nail complex. I think that that's always helpful. Especially if you get a good one. Like, we carry one by Designs for Health, which is a medical company. But if you could get some kind of oral collagen, that's helpful. And then follow my instructions. That's always helpful. Okay. I'm gonna come over here and just needle this. And you don't really need to worry about any issues because it's all your own blood. So I'm not putting anything into you that's unusual or foreign. Okay, turn the other direction. Let's go way back here. And I always say, in order to help healing, foot rubs help, back rubs help. Absolutely no cooking or cleaning or anything like that tonight. So, all right. Well, you did it.
That was it, huh?
That was it.
Okay.
So, if you enjoyed the video, please share it. If you know people that can benefit from this, please tell them to give us a call and find out more at RejuvenationMDMedspa.com.